Hello again, it's Liz. Today we're going to talk about the different types of nurse practitioners we can be when we grow up. So I'm about to start my last semester of school to be a family nurse practitioner. We're going to talk a little bit about all the different types of nurse practitioners, maybe why you would lean towards one rather than the other, and I'll show you there's like a ton of different types. We're not even going to go over all of them because they are constantly evolving and adding different certifications that you can do. If you look at it, it's expanding rapidly. They're making certifications in all sorts of stuff. This is 2017, 2 more days left in 2017, and even this year they've added, I think, like all sorts of different ones. So to start with, like I said, you can be certified in many, many different types. There's different accrediting bodies. That's confusing. We'll talk about that later. If I had to break it down into the main differences where you kind of, if you're sitting there like, yeah, I kind of might want to be an NP, but what type? The biggest things you're going to want to look at are, do you want to be acute care or do you want to be primary care? So that's one thing. And then what's your population? Do you want to do kids? Do you want to do adults? Do you want to do both? Would you like to do elderly? Would you like to do itty bitty babies? Those are going to be your biggest defining factors. After that, everything can kind of fall into place. But your first things you want to look at are your setting that you want to work at and your patient population. They both have like positives. It's depending on your personality. Like things that to me, I'm like, ooh, other people are like, awesome, I want that. So things that are coming with acute care nurse practitioners, you're going to be in the hospital probably. So you're going to be on the floor. It's inpatient. A lot of people do like inpatient rounding, and then they also do clinic hours. You're going to be rounding maybe with the team. You're going to do nights, weekends, holidays. At the hospital I work on, a lot of nurse practitioners, they kind of follow, they work like 312s. That's awesome. That's an awesome schedule, but sometimes it's at night and it's on Christmas and Thanksgiving, and that's something you may want to move away from. You can get paid a little bit more in acute care. It's focused on acute treatment. It's like tertiary care when you're going on the levels of care. You're treating the problem that is presented in front of you. It's already there. There's not a huge emphasis on like prevention. So it's all about what you are kind of passionate about in your nursing. You are going to be in a faster paced environment. Hospitals, you're going to either be working like in an ICU, if you're even on an acute care floor, that's going to be a very different environment, from nursing than it is in a doctor's office. So just kind of factor all of those things in for acute care. Those are, I think, the main highlights of acute. It's less skills too. You do a lot of procedures, a lot of things like that, skills-based procedures, fast-paced, hospital stuff, kind of similar to if you're working on an inpatient nursing floor. You're doing the stuff that, you see the nurse practitioners, the residents, the PAs, all of them doing. If you're going for the primary care route, that is going to be, I don't want to say like slower paced, it's just a different pace. It's primary care. It's a doctor's office. Hopefully no one's going to be coding all the time. You're not going to have all sorts of active cardiac arrest, stroke, those type of crazy situations all the time, hopefully. But you're seeing patients on a more long-term basis. If you want to get to know your patients and see them for years and years, that would be a better environment maybe for you. If you're more on the preventative medicine side, where you want to like prevent people from getting to the hospital, if you're super into education, if you are really passionate about just providing like care to underserved populations in their hometowns, that's a great thing for primary care. Sometimes primary care can get paid a little bit less. Primary care also does a lot of like education, just, like it's primary care. So you also are going to maybe have less nights, weekends, and holidays. I say less because now a lot of people are transitioning into doing, like, there are Saturday hours at a lot of clinics. A lot of places have on call, where you're going to be on call either on the weekend, you're going to be on call at night. A lot of centers have like phone lines, which I think is great that you can call, but it's not something anymore where I think know, 5 years ago, people were like, oh, I'll be a nurse practitioner. I'll work like 8 to 5. It's not really the case anymore, but primary is a lot more less weird hours than acute care. You won't participate in rounding. You'll be based in a doctor's office. Those are, I think, the big things for primary care. When you're looking at your patient population, obviously you can do pediatrics, you can do adult, there's gerontology, and then there's family. Family, I didn't know this until my family program. They call it womb to tomb. So I think it's kind of morbid, but sort of funny. You do the whole lifespan. That I think also has some positives and negatives. When you're learning about it, the programs are a little bit longer. You are learning so much that I think you specialize less. But you do get a pretty good overview of like everything. It's just about who you want to deal with. I think one thing, if I had to give you a tip, something that I really liked doing before I figured out what program I wanted to do, is I looked for jobs that I thought looked interesting. So I would go to the job pages and I would look and I would see that job looks interesting. Maybe I'd like to do that, and look and see what the requirements are. And it'll say, you need to be a family nurse practitioner. It'll give you options. It'll say you have to be an acute one. And that kind of gave me a good idea of what type of program I wanted to end up going into, because a lot of the ones I was like, ooh, that job looks cool, and they were all family. So that's how I ended up picking family, and that's something that I think would be really helpful. Look for your jobs before you even apply, and you'll kind of know what area you might want to be into. So yeah, those are the different type of NPs. There's also a ton of other like subspecialties. Now they have emergency, they have psych. There's many, many different type of subspecialties. So I would just look into whichever one looks best for you and go from there. All right, thanks. See you soon.